Good morning, everybody. Get ready to have your mind blown. Carol Petersen is back with us. Carol, welcome back. Thank you for your time again. So how's everything going?
Oh, it's going very, very well.
Good. Spring is here at last.
Yes, I had a lovely walk this morning. It was a joy.
What's it like where you are? You're in Toronto, right?
Yeah. Sunshiny, clear, warm.
At last.
That's what
Oh,
you live for all winter.
yeah. I know. I'm open the curtains. Spring is here. Well, Carol, I invited you back on to discuss thyroid. So much confusion still around thyroid, like so much. And now there are different opinions coming out, which we can get into later from other leaders in the field, like Dr. Alan Christensen and a few others. But yeah, I wanted to discuss thyroid, a lot of confusion, and luckily you're in Canada, so you kind of know what it's like trying to deal with the Canadian doctors and get things tested. But we have a lot of not only confusion, but I think misnomers out there. So, first things I wanted to start off with was something that I read in and I know you're a big fan of Dr. Broda Barnes' book, Hypothyroidism, the Unseen Ill. Like, not only is it a great book, but it's a very easy read, which I really enjoyed. I hate those books that you get bored halfway through, and I'm like, I'm done with this. In
And
in that book, Dr. Barnes mentions that most women, well, he said 80% of people approximately postmenopausal are going to have hypothyroidism. What do you think of that?
after age 60. And I think we're seeing declines in thyroid just as well as you would see declines in other hormones too. And one of the things I'd like to reinforce is I have a priority of how you use hormones or examine hormones. So the first thing is insulin glucose, second adrenals, third thyroid, and then fourth, the sex hormones. And why this is so important is the adrenal glands are so important to the support of thyroid. You could identify somebody easily with testing and see that they have low thyroid markers and try to give them some thyroid. But if the adrenal hormones are also off considerably, they won't be able to tolerate that thyroid. I've heard this happen several times, and probably I don't hear of all of them, but an attempt to use some thyroid and just can't use it. The heart starts to palpate. People report like tight feelings in their chest and their head and all kinds of mysterious things going on. And it doesn't mean that they don't need thyroid. It means that you need to have the adrenal support and able to use that thyroid successfully. So I think that's one issue that comes up from time to time.
Mhm. Yeah, I have always said an easy analogy that if you think of your thyroid gland and your adrenal glands like sisters, if something happens to one, you're guaranteed it happens to the other. So if thyroid is low, you can bet your bottoms there's something going on with your adrenals there.
And so I always think you should look at that first. Now, one of the things that Ray Peat once wrote was there's a list as long as your arm of everything that can interfere with your thyroid function. And there are three things that help your thyroid function, and they are progesterone, which I'll prioritize because I like to make sure people get enough, pregnenolone, and then the third was coconut oil.
Mhm.
And it sort of reminded me of Sesame Street or something, which one doesn't belong.
Yeah.
So I did a deeper dive into coconut oil. We think always for coconut oil, we're thinking about short chain fatty acids in there. But coconut oil is actually more complex. And if you look in a little bit deeper, you'll find coconut oil actually has steroid-like molecules too.
Yeah.
And so I believe that's what's supporting the thyroid when you use coconut oil. And it can, and coconut oil can be quite remarkable for some people if they choose to use it. So and definitely on the other side of the oil picture, if you are a user of seed oils,
Mm.
that certainly is a huge thyroid suppressant, and this is everywhere. Anytime you go out to eat in public, you're in big danger
But not only are you getting the seed oils, you're getting the seed oils that have been heated to a massive level as well.
of having seed oils being used in the cooking of your food. So
Oh, we froze there for a minute.
yes.
So I was saying not only are you getting the seed oils, you're getting the seed oils that have been heated to a massive degree. So now they're also oxidized and more damaging. And people don't get this. A lot of people, and we're not saying don't ever eat out or don't have a life, but a lot of people don't realize how much exposure they're getting and that it's just a harmless burger from Wendy's. It's not though.
No, no, and it takes a while for your body to get rid of those seed oils after you start using more beneficial oils. So there's that piece of it uh, that your thyroid needs support. So often when I start working with somebody who's, let's say, perimenopausal and having some pretty devastating effects of hormone imbalance, I almost always will start with this two-pronged approach. One is progesterone, and I think we've talked about that before. I always like women to know how to balance their progesterone first. But I'm also commonly adding some iodine.
Mhm.
And here we'll start getting into the controversy that's suddenly come up. But many years ago, I saw a study that was done with glandular thyroid replacement. And the study showed that women who were using a thyroid formula were actually getting breast cancer at a larger rate than women not using it.
Mm.
And I thought this was discussed at the time with several people, like, why should this be? Because in general, people who have cancer are hypothyroid. They're metabolically slow. So the thyroid should be really helping and help prevent breast cancer. You would logically think that.
Yeah.
But I think iodine is the key here.
Mm.
Um, so if you're low on iodine, if this is a feature of your low thyroid, because you need,
We're here. Yeah.
Chemaine,
Yeah.
I could switch to my hotspot. Maybe my Wi-Fi is doing this, freezing us.
Want? Excuse me.
I
I'm going to close some windows just in case I'm eating. Okay.
will, it will take me a minute here. Let me, this is going slow too.
I have you. Let's just go and see what happens. I can put it out as well.
Okay. So iodine is needed to make thyroid. So that could be the cause of your hypothyroidness in the first place. But iodine is much more than that. You need iodine to protect your breasts. You need iodine to protect your uterus and your ovaries, very much involved in your sexual organs. And also, iodine is an amazing anti-parasitic
Mhm.
kind of thing, and it's been used well over 100 years. Iodine is also a mercury chelator. I have a pharmacopoeia that's over 100 years old, and they recognized way back then that mercury could be removed from the body with iodine.
Mhm.
Also, if you're exposed to bromine, chlorine, fluorine, those things are building up in the body to the suppression of your iodine, or iodine, more iodine is needed to maybe flush some of that out. And indeed, when you do follow that and have high halides like the bromine, chlorine, fluorine, and you add iodine dosing, you can actually see those things go down. So there's so many things that the iodine does. So along with putting in the iodine to support all these things, plus progesterone to do the things that progesterone does, as well as support the thyroid, there are cases where your thyroid activity may actually improve.
Mhm.
So I ask women to be sure and monitor their body temperatures and their pulse rate to see where they're getting. A pulse rate around 80 is good, according to Ray Pete. And also, you need to be in the 98s. And that work came from Broda Barnes,
Yeah.
that you have to have your temperature up.
Yeah.
It's in your mitochondria, thyroid, active thyroid, T3, meaning tyrosine plus three iodines, is the most active thing that helps you keep your body temperature up.
Mhm.
And I find this quite interesting too, because we may compensate when we're a low thyroid person and not keeping our temperature up. We compensate by exercise.
Yeah.
I'll, I'll give you a couple examples. One woman told me she's a marathoner in her 40s. She said she never feels as good as she does when she's running, and running totally steadily. And it keeps her body temperature up. And I'll find that women who may be low thyroid, they're very active women. They move all the time. They do something physical. They're not doing a desk job. They're working on a farm or something. And that gets their body temperature up. The activity increases your body temperature and increases your metabolic rate. And if I see tests with some of those women, their thyroid markers are quite low, and they're compensating by the movement.
Because it's a falsity. Like you're just kidding yourself. Because you also have, why do you feel so good? It's like when women say, oh, I've been fasting for 3 days and I feel wonderful. Yeah, because you're jacked up on adrenaline. And adrenaline does make you feel good. Is it, but it's a misnomer. It's not true. You're not truly feeling good. You're just on an adrenaline high, which in itself is a problem for the thyroid.
Yep, it certainly can be. I like that adrenaline high stuff. There are people who actually have trouble with adrenaline, and they don't metabolize it very well. And this is the life they know. Their adrenaline is rather high, but they're also love the feeling of being jacked up on adrenaline. It's kind of an adrenaline addiction.
They're
And
very discombobulated because they have the high adrenaline, the low thyroid, low progesterone, and then if they're having issues metabolizing adrenaline, they've probably got some liver and gut issues. Like everything is very out of sorts. So there's not only confusion in the body, but confusion in the brain there, and they think they feel good and they can run for 10 kilometers, which is crazy in itself. But have you read the book The Iodine Crisis by Lynn Farrow?
No, I haven't read her book.
You should. You can get it on Amazon,
Mhm.
but she's on the podcast, so I'll send that link to you as well with the other links in the email to listen to. Lovely, lovely woman. So she's a journalist and she dove deep into all things iodine, including Dr. Brownstein's work. So everyone was all, for lack of a better word, convinced that iodine was amazing, which it was. I've been using it for years topically. But then you have Dr. Alan Christiansen lately coming out and saying, no, iodine is a bad idea. And now we've got all this confusion surfacing again. And I'm like, why is he saying this? And then, of course, your friend, Dr. Mercola, as well, agreeing with him. And I'm like, but hold on. The thyroid is made up of iodine, for one. And his argument is you get enough out of your diet. And I'm like, well, you're not speaking to the people I'm speaking to. They're definitely not getting enough in their diet.
So when this came out, I called David. I said, here's the link. I said, listen to this. They mention you too, because I don't want to listen to it. And I said, he's saying iodine is poison, actually says that, and that trying to suppress your availability of iodine to your body, that it actually will help you with the autoimmune thyroid antibodies. And so David tells me this. He said, so tell me then, in the last 50 years, the amount of iodine in the soil in the US has gone down 50%. We're not in an iodine excess in our food and our veggies. It just isn't happening. And then he said, well, maybe you get the antibodies down, but at the same time, you're damaging your thyroid. What's the good of that? So he said to me, I think he said 7 or 9 people in his practice. He said we have well over 9,000 patients using iodine. And he said, yes, there are a couple who have trouble with iodine and seem they can't use it. So it's very, very rare. And he said he and his staff sat down one day and said, if you only had one tool in your toolbox, what would you use? And they said iodine. You get such amazing results with iodine. Now, I will just relate something personally because I had fibrocystic breast disease. And in my first introduction to progesterone, I started using some progesterone on my face. I was in my 40s. I started getting these little wrinkles by edges of your eyes. And I read that progesterone was very good for preventing that. So I'm putting progesterone on my face every day. And to my surprise, in about 4 months, my fibrocystic breast disease melted away, except for the largest lump had gotten smaller, but it was still there. I happened to talk to Dr. Eugene Shippen, and he said, we always get rid of cauliflower breasts with progesterone and iodine. And so he advised me to add some iodine to what I was doing. And sure enough, that did it. Anytime you're growing these abnormal things, you should always suspect low iodine, and you can probably see a change, a marvelous change when you do use iodine. And so that's been my basis for all the time I've been doing hormones. You need iodine. One of the places with estrogen metabolism, there's a estrogen 6 alpha, excuse me, 16 alpha hydroxyestrone has to be metabolized over to estriol. The estrone there is considered to be pretty potent and maybe even DNA damaging. Iodine and thyroid is needed for that conversion. So why would you be suppressing iodine in somebody's diet or whatever when that's so crucial to proper estrogen metabolism. It doesn't make any sense. So I'm quite shocked. Now, when I think thyroid antibodies, this is where I go. You got to make sure vitamin D is adequate, and you've got to look at the gut microbiome, because how do antibodies form in the first place? Things are getting through your gut wall barrier, and your body's reacting by creating antibodies. So the solution is to go back to pay attention to the gut. Now, how iodine is able to do this, I have, or lack of iodine is able to fix this, I have no idea. And when you have thyroid antibodies, it's not forever. These things come and they go. And it's very much dependent on what's going on with the microbiome, I believe.
And the stress response as well.
Right, certainly could. So um, people don't often get their antibodies tested, and it's because conventional medicine has nothing for you. If you come up high with the antibodies, they're like, well, we'll wait and see what happens to you, right?
Well, regardless of the thyroid, as you just mentioned, and I do have this here, and I believe you've read this one. Um, this
Yep.
is Dr. Derry's breast cancer and iodine. Like it's not like we're just pulling these ideas out of our ass, for lack of a better word. Like we've got the iodine crisis, we've got that book, we've got Dr. Brownstein's work. Like the information is solid, but regardless, it has all the other beneficial displacement of the heavy metals, the antimicrobial aspects. Lynn Farrow discusses a lot about cognitive performance and making someone, for lack of a better word, smarter. So there's lots of other benefits to iodine. Why wouldn't you use it? And like you said, the mercury topic's huge right now. But there is one thing, it's really interesting what Dr. Alan Christensen says about like thyroid antibodies. The one thing I agree with him is that he thinks at this stage testing thyroid is almost pointless because you might see someone with perfect levels on a piece of paper, but they come back to you and they have all the symptoms and they have low temperature and very low heart rate. And he also then says, really the only test that's valid is TPO or the thyroid antibodies. But even then, he said, you might have someone with low antibodies, but they've still got all the symptoms. So what I gathered from it was, okay, testing is pointless. Let's just look at the symptom pictures and the temperature. So yeah, you have to kind of take some things with a grain of salt, I think.
So it's really hard. I believe you can tell some good things from a more extensive panel, a whole thyroid panel with TSH, pituitary hormone, free and total T3 and T4, and reverse T3, which is a mirror image of T3. And if that's elevated, you're in this hibernation kind of state. You're tamping down your thyroid. So that's not exactly a good place to be. And you can see that on a test. And if you actually have high reverse T3, back to your adrenals. The adrenal support probably isn't there. If your body's down regulating and hibernating, that's a good indication that your adrenals are probably getting exhausted too. So I think it's a good clue. Now, somebody told me that even if you are in range for reverse T3, if your total T3 is not 20 times higher than that, it's still a significant problem. That reverse T3 is a significant percentage of your T3 activity, and it's favoring the shutdown. Dennis Wilson developed a protocol based on reverse T3, actually. It's meant to restart you from this hibernation state. So you could have, he says, you go into this hibernation state and get stuck there. So by giving you more active thyroid, T3,
Yeah.
and he has a protocol with steadily increasing that amount of T3 every week and monitoring your temperature till you get a normal temperature, and then you start backing down and seeing if it sticks. You have a reset if it sticks. And I've known doctors to swear by this therapy for many of their patients. It doesn't work 100% of the time, as I understand, but it could be a very effective tool for helping somebody do get that reset. Now, having said that, I actually had a couple I was consulting with, and they decided to both do this. And the husband, did extremely well and was flying high and feeling great. And she had a terrible time. And why she was having a terrible time was she was having trouble tolerating it, like we spoke about before, the heart palpitations and the weird feelings. And so, what I could also see with them both having done metabolic testing is her adrenal support was very much less than his. And I said, this is what you have to do. You have to go back to the adrenals first, and then maybe you can tolerate this reset. But the way you are right now, it's not tolerable and it's not helpful to do it.
Mm-hmm. And it's almost a waste of money as well. You're
Yeah.
taking something that you're not benefiting from. And this is just in regards to testing, something I look at a lot for an indication of thyroid issues. I tend to focus on the symptom picture more, but I do look at cholesterol. But this morning I got sent a blood test this morning to look at, and cholesterol now looked perfect. But even though TSH, as we'll discuss in a few minutes, is not our primary focus when looking at a thyroid panel, because I think you'll agree, not only is it a pituitary hormone, it can be a marker of inflammation. But so her TSH was 4, and then her prolactin was 13. So straight away, I'm like, oh, they're quite high. Even though your cholesterol looks good, maybe this is that adrenal and estrogen dominance aspect of things.
Yeah, from the prolactin. I think Ray Pete says look for prolactin as a marker if it's over 8, but approximately 8, as a marker of high estrogen effect and low thyroid. And now that I'm asking for the prolactin levels, I do see this. I spoke with a doctor yesterday who's in Florida, and we discussed that briefly. He's been doing this for years, monitoring prolactin, as we just discussed, and progesterone brings that down. That's that's the cool part. You can put progesterone in to help balance that excess estrogen. You can put um, progesterone in to support the thyroid, and prolactin comes down. Women sometimes report they get secretions from their breasts because if you test for it, probably you will see high prolactin. Prolactin increases when you're going to breastfeed. And I've talked to women, they had this leakage like for years and mostly ignored, or some doctors will put them on a drug like bromocriptine to suppress their prolactin, but with no really strong idea of what's underlying this abnormality going on. And that's when you look at all the hormones and look at the balance, and you probably will see progesterone being very low. One of the things I haven't solved is it would be nice to use progesterone postpartum in large doses, but if somebody is breastfeeding, how much progesterone can you actually use without suppressing the prolactin and
Yeah,
stopping the milk flow? That's a consideration. So I kind of rely on pregnenolone as a backup for
yeah.
that. And pregnenolone, I'd like to mention, is another hormone that really supports thyroid activity. So I've been recommending pregnenolone with a combination of progesterone more and more because this is exactly what I'm looking for. I'm looking for the thyroid support often.
You know, Pregnenolone destroys me. I do not do well on pregnenolone. So I think February, and I spoke to Dr. Rosensweet about this. He had never heard of it. I'm like, here you go. This is what happened. And I spoke to Kitty about it as well. I decided to use I was like, I'm gonna give the Onus pregnenolone a shot and see how it helps with my sleep because I was going through a high stress time. And absolutely wonderful for my sleep, but destroyed everything else. Immediately, like within a few days, I converted all the pregnenolone down to estrogen. And I'm very tight with my everything I do. I know my body to a T. I've been using Dr. Platt's progesterone for years. Like I know everything is refined. I know what works. So I'm like, okay, let's add in this and see. The response was crazy. I swole up. I put on like 8 pounds in a week. My breasts just swole, but they were so sore and tender. And I never ever get painful breasts except around pregnancy, which I'm not, but so sore. And then my cycle came a week early as well. And normally I'm on time. It came 21 days early. My mindset was terrible. I almost went into depression. I was shouting at my family. It was awful. I just was not myself, and I stopped it, and then within a few days cleared out the extra estrogen and slowly went back to get normal. Like in March I was praying, please come on, period, let's flush. But I did not do well on the pregnenolone at all, and I am hypothyroidism, Carol, and I'm even though I'm very lean and muscular now because this is my profession, like I'm everything I do is very refined. That proved to me, because I think I told you before, I was 280 pounds at one stage, and my sister has all the kind of obvious symptoms of estrogen dominance, the heavy bleeds and everything.
Mhm.
But I don't because of what I do. But that just reminded me that I am still very estrogen dominant because I converted it like that, like immediately. And since then, I've been trying to bring my thyroid level back up as well because the estrogen crushed my thyroid. It was a valuable lesson learned, but never again.
Okay, I'd like to propose something to you that it was more like a kickback with not enough pregnenolone. And this comes from Dr. Bill Clearfield. When he has women with anxiety, he uses 400 milligrams of pregnenolone. Ona's is 100 milligrams, I believe, per dose, is it not?
Yeah, it is.
And I did see
I
when
was
I
using
did a little bit,
200.
and you use 200.
Yeah, plus
So right
progesterone on
away,
top.
I don't know if it's if you actually created estrogen or you suddenly potentiated the estrogen. And I would have said, if you were telling me this at the time, I would say, use more progesterone immediately to flip those symptoms. There's a off balance here with too much estrogen effect. And it would really depend on what's going on with all your corticosteroids and your adrenals, what's going on with the amount of estrogen, numerous factors in there. But I suspect as on Kitty Martone's estrogen dominance support group on Facebook, they talk about, they call this estrogen kickback. And I wonder if you cannot also get that with pregnenolone. I saw a study done with a small dose of pregnenolone, and this was really small, at 10 milligrams, created seizures. And I go, holy cow, this shouldn't be doing this sort of thing. And I don't know how Dr. Clearfield got on 400 milligrams of pregnenolone, but I've since been recommending this more frequently. And there's another little piece of this. When you're really exhausted and cortisol is really low, I was always saying progesterone's going to help you correct that low cortisol. But as it happens, pregnenolone is directly one step away to make more cortisol. And they do call this the pregnenolone steal, that pregnenolone is depleted to create the cortisol, and why progesterone is low at that same time is because you're not making the progesterone from the pregnenolone as you should be. It's being diverted to cortisol. So there's this little symphony going on. So when I see like a flatline cortisol, I'm thinking pregnenolone needs to be in there for the best results to fill in the cortisol. Although it's not got the same properties entirely as progesterone, and women may need progesterone too. But for the most part, I've been very successful with that 400 milligram dose. And one of my clients is a 20-year-old autistic girl. Not only did it help her PMS type symptoms, but for the first time in her life, mom tells me she's having a conversation. She could speak because she could parrot what you said, but now they can have a conversation back and forth. I just get goosebumps every time I tell this story because it was a huge cognitive improvement for her. And I would say this is a very important hormone to look at in perimenopause. Now, when I'm asking for this to be tested, I'm seeing some very, very low pregnenolone. So let's go back to our main topic here, thyroid.
Yeah.
How do you make pregnenolone? It requires active vitamin A to make cholesterol into pregnenolone.
Yeah.
Are you eating vitamin A, or are you only eating beta carotene? If you're only eating beta carotene as found in the plant world, you need to convert the beta carotene to vitamin A, and for that you need thyroid. So this is the mechanism where cortisol can get high and pregnenolone suppressed. So I've seen some very, very low pregnenolone levels when this actually gets tested.
My thyroid was amazing, was awesome. I'm actually using Raina's desiccated thyroid as well.
Mhm.
So it was awesome until this experiment with the pregnenolone. And since then, I've been struggling to get my body temperature back up, which I connected to the estrogen, because estrogen will slow down thyroid function, which
Absolutely.
so many women don't know this. And then we've got
Absolutely.
our progesterone is pro-thyroid. So I actually every morning, Carol, I'll put a pump over my thyroid and massage in. But this as well, it's not just what we started the conversation with Dr.
Christensen?
No, Dr. Rhoda Barnes, what he
What
said,
about?
like over 60. Like you, people only come to me if they're sick or they have issues. I'm not seeing healthy people.
Uh-huh.
Most women who come to me, they're in perimenopause. They have all the symptoms of low progesterone and high estrogen, but most of them have the hypothyroidism symptoms as well. And you reminded me of the adrenal aspect, but I think a big part of this is the estrogen and getting that down and out of the body.
Yes. That's huge, that estrogen impact. And as you just described, you got an excessive estrogen effect from taking pregnenolone.
And I'm still trying to deal with it 2 months later.
Oh, you just bump up your progesterone and negate that today, okay? Promise?
Yeah.
Just
Well, yeah, I'm ovulating now, depending on if my body feels up to it or not.
But I'm liking that you read this, because
Yeah.
there we go. When you are in this estrogen dominant state, your thyroid activity is suppressed. And you can see some pretty normal thyroid levels when this is happening, when estrogen is way out of sight. And that will suppress your activity. You can tell by your body temperature and your pulse rate, it'll be suppressed. Another place to check on your temperature, to check on your adrenal support, is to monitor your body temperatures at 3 to 4 o'clock, late afternoon, because you often can have a dip there.
Mhm.
And as your body temperature goes down, your thyroid function is obviously impacted. There's a circadian rhythm for the adrenal glands, and that's an adrenal low time. That's when everybody's looking for a nap, they're looking for a coffee, they're looking for a sweet, a snack because their adrenals are on the low side. This is a normal cycle, but for some it's dramatic and it's a pretty big slump in the afternoon, and that's why we do all these activities to bring that up. So you're going to find your thyroid could be doing fine job, and then if the adrenal support really is lacking a bit, you'll have a drop. I've been seeing some interesting things because I'm asking people to do more thyroid temperature monitoring. I just had somebody send me a detailed list, and they were finding that actually after a walk, their temperature plummeted. And I found that kind of surprising. And then after some meals, but not all meals, their temperature plummeted. So I'm going to have to check into that a little deeper. I would.
I would just to cut you off there, I would wonder if there's obviously blood sugar dysregulation there, but
Mhm.
post walk, some people will go hypoglycemic walking and they won't recognize it. It won't be as obvious with the symptoms, but the blood sugars will drop there.
Right. And I'm also suspecting the adrenals getting to be a little low. Maybe they've pushed themselves a little much, and that's exhausting. And you can't really tell that without a conversation and seeing exactly what's happening. You know, how much did you exercise? How far did you go? How did you feel? Were you pushing yourself? Or when you ate, exactly what did you eat? And I've been recommending the Coca Pulse test
Yeah, I have that. Mhm.
for for people reacting to foods that they're eating. You can take your pulse before you start eating, and then during the time you're eating or slightly thereafter, if your pulse rate goes up, you're actually having kind of an adrenaline response to that food. You're reactive to that food.
Yeah.
So very interesting. And as far as foods go, I often say get rid of the beans, nuts, and seeds. And so when people are telling me they're having smoothies and they're eating very healthily, because they're very careful with their food choices, I always ask them to tell me exactly what they're putting in that smoothie because they think these are good foods and they're actually suppressing their thyroid. I had one client who had amazing boost her energy after 1 week of getting rid of these foods, which were a big part of her diet.
Mm.
And we're told that's our healthy beans are healthy. You need the fiber.
Mhm.
Um,
But they're all super inflammatory.
yes.
Then this is it. I get this all the time. I'm sure you do as well. People will come to us and they say, but I eat healthy. I'm doing everything. And then I'll look at the end of consultations. I always go through, okay, give me an idea of what you're having for each meal. And I'm like, okay, well, you're eating healthy compared to your neighbor who's eating Wendy's and Tim Hortons all day. In that comparison, yes. But in the grand scheme of things, it's not as healthy as you think. But also, depending on what pathway you're trying to go down, like, are you trying to get pregnant? Are you trying to prevent cancer? Like, it may not be for that. I spoke to a woman actually last week. This will make you laugh. It made me laugh. I'm like, this is how people think. So she told me they like changed all she's trying to reduce her estrogen load. So she told me they changed out all their cleaning products to natural vinegar, borax, all the good stuff. They changed out all their Teflon bakeware. So they did all that, except at she said at the end of each week, she has 5 beers on the weekend. So I was like, I kind of laughed and I was like, well, I'm not laughing to be obnoxious, but you're kind of outdoing what you did with all the cleaning stuff by having all this beer at the weekend because beer can stimulate estrogen. And I'm like, it doesn't make sense what you're doing. So I told her to cut out the beer. But this is how people think they're doing everything right, but it's these little things that you're missing and that only the trained eye would see.
Right, right. I'd like to interject here another thing I learned not too long ago. So when your body is creating a lot of adrenaline, and particularly due to a blood glucose drop, you need methylation for your body to detox the adrenaline, the estrogens, the histamine. And some of us are genetically weak methylators. So you support with methylation with methyl groups like the B complex vitamins and betaine and phosphatidylcholine. I also learned that methylation is important for the thyroid conversion from T4, four iodines there, relatively inactive thyroid, to active T3. Methylation's involved in that conversion as well. So poor methylators are also going to have a problem with creating active thyroid from the thyroid that your body normally produces. Your thyroid actually produces about 80% of the T4 and about 20% of the active T3. The rest of your activity is dependent on successful conversion to active thyroid as your body needs it.
So you have to do all the things. You can't just take
Yes.
thyroid and expect miracles to happen. Like you mentioned in the beginning, you have to start with the basics, like the nutrition and the sleep, because everyone wants to go straight into the hormones or the magic pill. But if you haven't got the basics down, you're wasting your money and time.
And another thing I'd like to bring up is we seem to have a plethora of over-the-counter thyroid products. And you mentioned using Rena,
Yeah.
and you feel it has a good effect.
I also use
There are
the
many.
glandular as well,
Uh-huh.
which I think is
Okay.
where you're going. Do you know the brand Life Choice? It's a Canada brand.
Yeah, I don't know that one.
Okay, I'll send you a picture.
So the trouble is, um, unless it's an FDA approved product, we don't have any idea what's in there. In fact, even the FDA products, like if you had IRFA in Canada or Armour Thyroid, it doesn't tell you. For example, official monograph will give you some idea, but they don't have, let's say, a quantity of T2.
Yeah.
That's actually another thyroid hormone. Rhoda Barnes thought the T2 part of whole thyroid had a lot to do with fluid retention. And if you didn't have adequate amounts of that portion, that was a problem. And that's why whole thyroid had an advantage over taking T4 alone or even combined with T3, you're still missing this important T2 component. And this is something we haven't studied very much at all as far as that. There are some T2 supplements over the counter available, and the people that got into using these were the people in the gyms working out because they don't want fluid retention. And it gives you a bit of energy too, as far as I understand. But again, the doses and what to do, when to do is it's still it's a jungle out there.
Yeah.
So there's a lot, and I recently reviewed a test with another practitioner. They were using another product which is over the counter for thyroid support. They got good results with that one. Now I have another client who's using one. Now her temperature looks okay, but her TSH has gone up significantly, and I think like 7 or 8 since she started using it. Well, this isn't good. As you mentioned before, TSH is inflammatory. So you don't want to stay with these high TSH levels, and it is a measure of success. If your pituitary output of TSH comes down when you support thyroid, that would be a goal. Your pituitary is like working overtime with these inflammatory stimulants to the thyroid. So it's a concern to me that this was going up again with an over-the-counter thing. But she doesn't feel bad, but her hair's falling out.
Problem. Yeah. I've had, I've spoke about this before. Who did I speak about this with? I think it was Paul Robinson. But I have a client when she takes T4, so synthroid only, her hair falls out. But if she pairs it with some T3 or desiccated thyroid, that doesn't happen, which is like most people have not heard of that. Like that's an anomaly in itself.
Well, I would say some percentage of people are like that. And how this happens is if you are a poor converter. Conventional medicine goes to T4 as a first choice. And there are people who do very badly on that because putting the T4 in does suppress the TSH from the pituitary. That's good, except now your signal to your own thyroid production, which did give you 20% T3, is suppressed. So your own thyroid's likely to put out less active thyroid. And if you also have a conversion problem, taking T4 only can leave you worse off than when you started as a low thyroid.
Mhm.
It's a very important point.
Yeah, it is because especially in Canada, the majority of people are only getting Synthroid. That's all they're getting. And back to the glandulars, because yourself and Dr. Mercola spoke about this. Glandulars don't have hormones in them, and he was asking, well, if is that only in the States? It's it is Canada, it's the States, it's Europe as well, and then I don't know about the Africas or the Middle East, but for sure it's Europe and Canada. And Dr. Eldon Dahl, I'll send you that video too. He's the owner of Life Choice Supplements, so just outside Calgary here, and they make a couple of different adrenals or glandulars. They make a thyroid, an adrenal, and a thymus, and they're quite good. Like I use the thyroid with a lot of my clients, and they do feel the difference, and we do see their temperature go up.
Mhm.
I wonder if maybe I should try the adrenal one now because I, I think you're correct. I am exhausted. I can feel it. My motivation is low. I can really feel it. But there's no hormones in those glandulars, but you're still getting the tissue and the different synergistic molecules, which a lot of people benefit from, along with the nutrition and lifestyle aspects.
Right. There's a company in the US, Standard Process, which has been in existence well over 80 years, and they have organ supplements. And Dr. Royal Lee, who started this, he identified something in the glandular tissue that wasn't the hormone, but supported
Mm,
your own glands. He called it protomorphogens.
that's interesting. And he proposes then that's where we're seeing the beneficial effect of a glandular is through those protomorphogens. I should connect you and Dr. Eldon Dahl together. I'm sure you'd have a fascinating conversation. Oh, he still got you, Carol? Okay, you're back. Did
Okay, yeah. He called these um, molecules protomorphogens without a great deal of exactly what they are, but each organ has peptides and nucleotides. Nucleotides is a whole vista that we're just awakening to as well. And it may be that royally identify these things without full knowledge of what exactly that they are, but they do support the various organs of production of hormones. So these products have been on the market and very successful for such a long time. You can't just discard the notion,
Yeah.
I think.
So there's two questions I just want to get to before we wrap up. Um, we did mention the pituitary. Where does the pituitary play into the thyroid? If everything looks normal on a blood panel, can there be something wrong with on the level of the pituitary, like hypopituitarism?
Yep. And there can be hypothalamic low hypothalamus production too, to the pituitary and then to the thyroid. So if it's your thyroid not working so well, that's primary hypothyroidism. If your pituitary is not signaling the thyroid adequately, that's secondary. And then there's hypothalamic, which now you're going to have to investigate a little bit more. But I would say conventional doctors uh, don't even recognize the secondary. When TSH is low, like down in the low ends, less than 1 or less than 0.5, they'll say, they can look at you in the face and you look at hypothyroid as anything and say that you're hyper because your TSH is suppressed. So that's so ignorant. I can't believe, but I still hear patients have been told this when really looking at your pituitary function needs to happen. And your pituitary um, can have some problems. Common things, you actually get some atrophy. I think it's called empty sella syndrome, or your pituitary could be poisoned. And with heavy metals, with things like atrazine and other chemicals used in agriculture, pituitary's been damaged, so it can't give the proper signal to the rest of your body.
How are we testing that, or what are the symptoms we're looking for to give us an idea that this may be the problem?
Well, you could, if you were testing on a panel, you could see TSH very, very low with no supplementation and correspondingly very low thyroid T3 and T4. I would suspect the pituitary. You can do a TRH challenge. Thyroid releasing hormone comes from the hypothalamus, so you can stimulate your pituitary to make TSH. But what happens in that test, if your pituitary's not making the TSH, you kind of flatline. You do this over a period of time, like a few hours, and keep measuring the TSH. No response, no pituitary activity. You could also do measure other pituitary hormones, LH, FSH, prolactin, IGF-1. The other pituitary hormones can give you some idea if this is generalized or one hormone system. So I think you have to look further.
I think you mentioned before as well that there's a specific body shape for women who may have issues with their pituitary.
Oh,
When I heard you mention that, I was immediately brought to the idea of one client, and she has issues with syncope as well, and I'm confident their thyroid is playing a part there. But when you described the body shape, I was like, oh my God, that's her. So the bigger breasts,
yeah.
the bigger
Like
hips.
women, big breasts, big rounded butt, and kind of a hanky down belly, like an apron belly, is the body shape for a low pituitary person.
That's super helpful, but I can just hear every woman saying, that's me.
If you really think about it, a lot of people probably have seen exactly that person who has that shape. And I don't think everybody jumps to the conclusion it's them. It's so extraordinarily different. But in my hometown, central Wisconsin, atrazine's used a lot on the potatoes that are grown there. And I learned once just riding around my car on the news, my home county had the highest levels of atrazine in the groundwater in the US. And then if I go to my hometown and I'm out like the 4th of July, where a lot of people come out, you see this body everywhere. And I think, oh my God, we're just been so poisoned in this area by the atrazine, probably.
Yeah.
But I'm just kind of building a theory based on
Yeah.
what I see. But it's interesting that so many people have that shape, and it's very clear that something's going on.
Well, I come from the home of the potato, you know that.
No, no, no.
Uh, so one last question, if you don't mind, do we have a minute to do one last question?
Sure, sure.
Um, Nobody wants to hear this because I feel like we're beating a dead horse, but I still think it needs to be highlighted. Birth control and hypothyroidism. How does birth control influence the thyroid?
Oh, absolutely. It's going to suppress your thyroid activity. Probably two ways, because you get excessive estrogen. You have an estrogen-like molecule that isn't actually converted very well and gotten rid of. It persists in your body. So you're more and more estrogen dominant as you're using that. And I will use the tendency of birth control pills to increase sex hormone binding globulin enormously. So you know you're very, very estrogen dominant. And then
You're right. I completely lost you. I don't know what happened there.
I'm sure it's my Wi-Fi. I've been struggling over the last few weeks. Bell, I've had them here. I had them fixing things over and over again. I'm gonna have to
We
call
were wrapping up with the not the IUD, the birth control aspect of things.
again.
You're back again. So
Okay.
yeah, let's just wrap up on the birth control.
Okay. On the birth control, I already spoke about the estrogen portion, and the other portion is a progestin, not progesterone. And remember, I was saying how much lost that. So now you're taking regularly two drugs that are sort of how many years some women have taken these drugs. It's shocking to me that we can survive. It's and sometimes have some quality of life, but
I hear,
terribly thyroid suppressant.
yeah, I hear women taking birth control for 30 odd years since they were a teenager, just stopping to get pregnant, back on it, and then transitioning onto an IUD when they start getting the perimenopausal symptoms. And then they just stay on that till their mid 50s. They don't know when they went through menopause. They like it is crazy. It is just crazy.
It is, and they're not going to be very healthy. I will guarantee that.
Well, if they were, we wouldn't be speaking.
I'm just, that's right.
Like it's just such an injustice is being done to women over the years. I'm sure in the beginning there was some genuine desire to help women, but just constantly throwing all this at us for decades and decades and decades, and then wondering why we're struggling so much now, or the prevalence of different diseases is growing and growing. Like it's just mind blowing.
Well, this concerns me, and every
Gotcha.
Chemaine, I'm going to see if I can just switch my Wi-Fi. I got my phone on now. Let's see.
You need to get Starlink.
Okay, now I'm on my hotspot. Let's see if that's better.
You were saying this concerns you about the prevalence of disease now.
Well, every professional, as I was saying, has to do courses in science like physiology, biochemistry. And then you go into professional school, whether it's medicine, nursing, pharmacy, what have you. And it's like you throw away the basic knowledge that you just got in those science classes, and you're taught to use these altered molecules as if they were the real molecules, and they're not. They create all kinds of disturbance. And what does it take for people to wake up to the fact that all estrogens aren't the same, all these altered estrogens and all progesterone-like things are not progesterone? Really mucks up the whole literature, the medical literature, synthetic estrogens or conjugated horse estrogens. You don't get the real science in the science, so-called science being presented. So people are confused, the general public, for sure,
Mhm.
that they learned much earlier. So why would you put this chemical in the body to replace? I just got sent a inquiry from somebody who operates PMDD counseling in the Netherlands. I believe she has a client who had severe postpartum depression. Instead of progesterone, which should work very nicely, she was given Dufastin, dihydroprogesterone. It sounds like it's not that bad, but no, it's it's not. It's it's not progesterone. And she's been institutionalized in medical and mental health hospitals, and she's given other drugs, all for the lack of progesterone. And who gave her that? A postpartum depression expert. Just
Yeah, maybe we should re-term what the word expert means nowadays. God, that's sinful. That is just, you're taking someone's life from them.
was 28 years old,
That is just
this girl.
awful. Um, I don't know, re-education maybe for these experts. I don't know. I mean, we've spoke about it before, the financial involvement in it and why we're getting prescribed certain things, but maybe some of these experts do need to be re-educated.
Just well, let's go back to the what we know about basic biochemistry and basic physiology.
Yeah. Well, Carol, before we break up again, I'll be able to cut them out for the podcast, so it's okay.
Oh, thank
Um,
God.
but thank you for your time. Hopefully you get your bell sorted. I have the same issues here with Talis. I'm like really considering going to Starlink. Like we don't have to deal with Tom Ford here, but however. Well, thank you for your time, Carol. Much appreciated as always.
Oh, my
We'll chat
pleasure, Chemaines.
soon and I'll get
Okay.
all of those links over to you. Like you'll really enjoy the one with Lynn. She's very much reminds me of you. You've the same personality. She's very nice and lovely. And then Dr. Eldon Dahl, who's here just outside Calgary, who makes the glandulars. So I'll send
Okay.
them to you as well.
Okay, perfect.
Okay, thank you, Carol.
Thank you, Charmaine. My
Bye.
pleasure. Bye.